When a medical emergency strikes, it feels like chaos, right? But underneath all of that, there's actually a system, a really smart one, designed to beat the clock. It starts with the basics and then builds to something much more complex. Today, we're going to break down its two core pillars: basic life support and advanced cardiovascular life support. Okay, let's just imagine it. It's a scenario none of us want to be in. Someone right in front of you suddenly collapses. What do? What happens in those first few critical seconds? Well, it turns out there's a playbook for that, a set of building blocks that can totally change the outcome. So let's dive in. Everything, and I mean everything, starts with the foundation. The very first response, those immediate actions you take right there on the scene, that all falls under one name: basic life support, or just BLS. So what is BLS really? Well, think of it as the essential toolkits, the fundamental stuff that anyone, and I really do mean anyone, can learn to keep a person alive until the professionals can get there. It is the first response, and you could absolutely argue it's the most important one. And this right here is what's so powerful about BLS. It's not just for doctors and paramedics. Millions of regular people, trained laypersons, folks like you and me, are a massive part of this system. In fact, getting CPR from a bystander right away can double or even triple a person's chance of survival. You are the front line. And BLS isn't about winging it. Not at all. It follows a very clear, simple protocol. First, you make sure the scene is safe. Then, you check on the person, you call for help, and then you start CPR and use a defibrillator if there's one around. It's a step-by-step guide that's designed to work even when you're under a ton of pressure. The goals here are crystal clear. You're basically taking over for the heart. You're using high-quality chest compressions to keep blood flowing to the brain. You're using an AED, that's an automated external defibrillator, to try and shock the heart's electrical system back to a normal rhythm. It's all about buying precious, precious time. And here's the key thing to remember about BLS. It is all non-invasive. We're talking no needles, no drugs, nothing that breaks the skin. It's all built on these simple, easy-to-remember steps, which is exactly why so many people can learn how to do it and do it well. But what happens when you hear those sirens, when the ambulance pulls up? Well, that's when we move to the next level of care, and it builds directly on that foundation that's already been laid. And this is so important. ACLS does not replace BLS. It can't. You can't have one without the other. Good, strong, early BLS is the launch pad for all the advanced care that comes next. Without that good CPR happening from the start, those advanced techniques just aren't as likely to work. So now we're in the ACLS phase. This is a whole set of sophisticated interventions that are designed to fix the underlying medical reason for the emergency. And they do it using advanced skills, fancy diagnostic tools, and some pretty powerful medications. The people performing these skills are different too. We've moved on from the first responders and trained citizens to a very specific team of highly trained medical professionals. These are the people who have the knowledge and the authority to make incredibly complex decisions in the heat of the moment. As you can see, the components get way more complex. Now, high-quality CPR is still the bedrock, that never changes. But ACLS adds things like reading heart rhythms on an ECG, giving emergency drugs like epinephrine, and securing an airway with advanced procedures like intubation. And this really gets to the core difference. Unlike BLS, ACLS skills are often invasive. They involve medications, IVs, and advanced procedures. So it's not just about following a simple algorithm anymore. It requires a deep, deep level of clinical judgment to react to what's happening with that specific patient. Okay, so we've looked at both of them on their own. Now let's put them right next to each other to make those differences really pop. If you only remember one thing from this whole explainer, let it be this. BLS is about external, non-invasive support. It's about keeping the pump going manually. ACLS is about internal, invasive interventions. It's trying to fix the pump from the inside with medicine and advanced procedures. And here it is, all laid out in a chart. You can really see that clear progression, right? You go from the foundational level of BLS, focusing on non-invasive stuff like CPR, up to the advanced level of ACLS, which brings in diagnostics, drugs, and invasive skills that demand some serious clinical judgment. So we've compared BLS and ACLS, but to really get it, we need to stop seeing them as two separate things and start seeing them as part of a single integrated process. And honestly, this might be the most crucial point of all. It was never BLS versus ACLS. It's always been BLS leading to ACLS. They aren't competing. They're like perfectly interlocking gears in one single powerful system that's designed to do one thing: save a life. And that system? It has a name: the chain of survival. See, recognizing the problem and calling for help, starting CPR right away, using a defibrillator, those are the first few links, the BLS links. They're followed by the advanced care and the post-arrest care links from ACLS. For the whole thing to work, every single link in that chain has to be strong. And let me just leave you with this one last thought. Experts will tell you over and over again that the early links in that chain, the BLS links, are the ones that matter most for a good outcome. And all of that happens before an ambulance ever arrives, which really just leaves one question. Could you be that first most important link for someone?